Welcome to the second last CPD Masterclass for 2022. And my name is Thabang Sogolela, Manager in CPD and Registration Unit. And with me, I'm having Mr. Mokwadi Morano, who is the Senior Manager in CPD and Registration Unit. And we are also joined by the team from Communications and Media, and they are led by Mr. Madimeja Mashishi. So the team from Communications and Media are responsible for streaming of the event on Teams, SAPC, Facebook, and YouTube page. And they are also responsible for managing and moderating comments and questions received on various channels during take 2 hours. So we encourage you to remain with us until the end so that you get all the information firsthand. And the presentations will be made available on SAPC website, and all the queries that maybe they are not, you didn't manage to raise during the workshop, you can still submit them to the office using the email that has been provided there. And lastly, there will be a link on that will be shared on chat. That link is for the poll, and I'm requesting colleagues to complete it. It's a very short one. It will take you 2 minutes. So if you can just go to that link and complete the poll, we will appreciate it. And because your response we're going to refer to as we continue with our workshop. And feel welcomed, feel free, and feel we will appreciate your participation. Thank you so much. We will be moving forward. Okay, thank you. I hope colleagues can see the cover page of our presentation. Like I said during the introduction, my name is Thabang Sogolela, and I'm the one who will be taking you through this presentation. Let's move on to the next slide, please. Thank you. This is the outline of our workshop. So we will be looking at CPD requirements, wherein we will be focusing on annual declarations and designation of persons. And then from there, we will look at CPD essentials, wherein we will be paying more attention on competency standards, domains and competencies, and the frequently asked questions and facts. Then the third topic is on how to learn or how to navigate through the CPD or how to submit. So that's what we will be looking at on that item. And then this here will focus on what constitutes a good CPD activity. And we will have a learning activities and evidence. And then from there, we're gonna look at compliance and archives, selection of compliance here, CPD submission deadlines, and then the highlights. So those are the topics that we will be focusing on today. CPD requirements. I believe some of the colleagues are not yet really comfortable or having a better understanding of what this CPD requirement is all about. So I hope by the end of this workshop, nobody will be wondering like our friend there. I hope everybody will be having a better understanding of what CPD requirements is all about and what is it that is expected of us. Thank you, Natalie. All right. CPD compliance requirements. Pharmacists are required to complete the online annual declaration by the 1st February of each year. So this is the first requirement for you to be able to move on to the next step regarding CPD. An annual declaration completion is the first thing that you are expected to do. And then secondly, pharmacists are expected to record at least 6 CPD activities. And these 6 CPD activities are recorded online on the CPD platform. Therefore, the office is not accepting any manual submission of CPDs. And then the third thing is that maintaining an electronic portfolio of evidence. So the CPD that we expecting you to submit online, unfortunately, we don't expect you to submit any evidence. And then at the same time, the expectation is that you must have your evidence ready in an electronic format so that when the office requires it or the office of counsel requires it, you'll be able to produce it. So remember, we don't submit any evidence, but you keep it and you have it ready for in case it is needed. And then the other thing is that pharmacists are encouraged to submit at least one entry every 2 months, or yes, every 2 months. So this will assist us in complying. Remember, we're having 12 months in a year. So if we're saying we need 6 CPD per year, by submitting one every 2 months, but you'll be able to submit the last one during the last month of the year, and that won't be heavy for you. Thank you, Natalie. Let's move on to the next slide. Okay, annual declaration. So the annual declaration is based on competency standards for pharmacists, which was approved by Council in February 2018. So the annual declaration is based on the domains, competency standards, and behavioral statements. And this, I hope colleagues have seen it when they completing their annual declaration, because after they have submitted their employment information, there will be a number of questions that they are expected to answer by indicating if they never do that, or they do it, or they do it sometimes. So those questions that you were answering there, I think they are in parts of 6 pages. So each page is for a domain with its competencies. So as you're saying, I do this, I do that, those competencies are related to your scope of practice. And at the end of the day, if you're saying you're doing some of those competencies, you will be designated as practicing. And if you selecting that you don't do any of those competencies, then you will be designated as non-practicing. So it's important for colleagues to pay attention when they're answering those questions, because as long as you are a pharmacist in our country, there should be something that you're doing. The competency standards were designed in such a manner that they cover all the sectors of pharmacy. And there is also auto-designation to practicing. So when pharmacists are not, after the 1st of February, when pharmacists have not completed the annual declaration, they will be auto-designated. So those who were practicing in the previous year, they will be auto-designated as practicing. And we want to emphasize this one, that the annual declaration should be completed by the 1st of February each year. Thank you. Yes. What are we referring to when we're talking of designation of persons? A person may choose to be designated as either practicing or non-practicing. So when we're saying a person is practicing, we're referring to the registered person. In this case, we're talking of pharmacist who is currently providing one or more of the services or performing one or more of the acts pertaining to the scope of practice. Here we will refer to the scope of practice of a pharmacist.
Tebang, are you still there?
I think Tabang is having connection. So a person who's practicing is a person who's providing one or more of the services or performing one or more of the acts that pertain to the scope of practice of a pharmacist. And a person who's non-practicing is a person who's registered, but is currently not providing one or more of the services that pertains to the scope of practice of a pharmacist. So you may designate yourself as practicing at the beginning of the year when you complete your annual declaration, and that would depend on the activities, on whether you select that you participate in those activities that are listed that are related to the scope of practice of a pharmacist, or you select that you do not participate in any of those activities that are related to the scope of practice, then the system will designate you as non-practicing. We may move on to the next slide. All right, some CPD essentials.
Okay,
you're back.
Yes, I'm back.
All right, we're on CPD essentials.
Am I? Okay, thank you. It's like we were having load shedding, so the power was kicking in, and I'm sorry for that. So CPD essentials. So here we're just saying pharmacists should take some time to familiarize themselves with the competency framework, and that will be discussed in more details in the next slide. Can we move to the next slide, please? So there are terms to remember. So when we look into the competency standards for pharmacists and other pharmacy personnel, we having what we're referring to domain competency standards and behavioral statement. And these terms, we will be using them a lot in this presentation. I will explain them as we move on with our presentation. So please make sure that you follow what we mean when we're referring to those terms. Okay, competency standard. Like I said, each competency standard is made up of, the competency standards are made up of domains, and from each domain we having what we call competencies, and for each competency there are what we calling the behavioral statements. So the behavioral statements, they are of different levels. We having those for pharmacists who are at the entry level. Here we're referring to pharmacists who are new in a particular field. So take note, we're not talking of experience. We're talking of someone being new in a particular field. You can be being a practicing pharmacist for so many years, but you find that you are new in a particular field. So in that case, we will expect you to be at the entry level when we're referring to the behavioral statement. And then we're having what we're referring to the intermediate practice and also the advanced practice. So these are those who are more experienced in a particular field. So these are the terms that you will be meeting when you're completing your CPD activities. So you must pay attention. There should be a domain, there should be a competency, and the behavioral statement. And the same terms you will see when you also doing the annual declaration. So that is how each competency is the competency standards are structured, yes. And then domains and competencies. We are having 6 domains which are listed there in the slide. Public health being the first one, and then the other domain is on safe and rational use of medicines and medical devices, and supply of medicines and medical devices, organization and management skills, professional and personal practice, education, critical analysis, and research. So all these competencies, you will see them when you're doing your CPDs. It's always important to understand what each competency is all about, so that when you're selecting when you're submitting your CPDs online, you link it to the correct domain and competency. Next slide, please. So here we're going to use domain 1, which is public health, as an example, so that colleagues can understand the domain and the competency very well. So somebody will say, public health, does this domain apply to me? Maybe somebody is working in regulatory, or maybe somebody is in academia and they just feel like they're not doing anything related to public health. So here it says the domain applies to all pharmacists who practice, includes promotion of health and wellness through the provision of healthcare information and education to the public and other members of the healthcare team. So as long as in your day-to-day practice, you engage in patients or members of the public, then this domain applies to you. And the domain has 6 competencies, as you see them listed there. The first one is promotion of health and wellness. So when you selecting, maybe when you want to submit a CPD activity under domain 1, then you must also choose the competency to which the CPD is maybe related to. If you are in a primary healthcare facility, you want to submit a CPD on something related to primary healthcare, then you will select that competency. So the competency are different. If you want to submit a CPD on medicine information, then you will select competency 2, but whatever will be under the public health domain. So let's get that one right. There is a domain, and for each domain there are competencies. And a person who has achieved this standard is able to demonstrate the following behaviors. Remember when we were looking at the terms that I was saying we will be encountering a lot, the domain, the competencies, and the behavioral standards or statement. So for a person who has achieved this standard, then that person is expected to be in position of these skills or this knowledge. The first one is to provide advice on health promotion, to provide advice on disease prevention and control, to provide advice on healthy lifestyle, and to participate in public health campaign. So for you to say you have achieved that standard is when we seeing you being able to practice all the behaviors that are indicated there. And then does the standard form part of my current practice of pharmacy? So this is where you will say yes or no. When you doing your annual declaration, to say this one, it does not form part of my current practice. I'm not doing anything that is mentioned under the competencies. Therefore, it's no. Then you won't be expected to submit any of the activities on that competency. And then if yes, on the basis of the evidence I have identified, I can do this. So meaning if you're saying yes, you're just saying this is related to what you're doing on a day-to-day basis. Therefore, you can be able to perform all those behaviors, or you are in possession of all those skills that are mentioned there. Next slide, please. The frequently asked questions pharmacists not working in clinical care tend to ask. So these are the questions that we frequently come across from other colleagues not in clinical care. The first one, they're saying, I only develop regulations. The second one saying, I am a pharmacist but not working directly with patients. The third one is saying, I research drug interactions and drug usage. And the last one is saying, I train pharmacists and pharmacy support personnel. So if you can listen to these questions, all these people are doing or they are performing the scope pertaining to the act of a pharmacist in different settings. And unfortunately, when the CPDs were introduced, people were thinking maybe they are meant for those who are in clinical care, but it is targeting all pharmacists. That's why it's important to understand the domains and the competencies so that when you're doing the annual declaration, you know which ones they apply to you, and in so doing you'll be able to understand that the CPDs are not meant for those in clinical care, but they are for us all, as long as we are performing any of the scope pertaining to pharmacy. Thank you, Natalie. Next slide. Okay, here are the facts that you need to take note of in relation to the questions that we were looking in the previous slide. Pharmacy practice is not restricted to the provision of direct clinical care only. It includes working in a direct non-clinical relationship with clients, administration, education, research, advisory, regulatory or policy development roles, and any other role that impact on the safe, effective delivery of service in the profession. So this is what the facts that you need to consider in relation to the questions that we have seen. And you are therefore obliged, your obligation is to choose CPD activities relevant to your scope of practice. However, you are not precluded from choosing other types of CPDs if this information is useful in your personal development. So as much as you may think you can say I'm not in clinical care, but if there is any CPD that you think you need to follow for your personal development, you must feel free to do so. Next slide, please. Okay, before we can go to how to learn, I'm going to ask Natalie to share the results of the polls that we just shared, the ones we requested you to complete, so that we can see how you people are feeling about the whole CPD. Okay. Sorry, Natalie, we received how many responses? Only 10.
Yes,
So
Tabang, at this point, we've only received 10 responses.
Okay, no, thank you so much. Here we're seeing that majority of those who have responded are very anxious, and only 2 is nervous. Then the ones who are happy and excited, they are 2. So we will try by all means to make sure that the anxious and the nervous colleagues by the end of this workshop are excited and happy. And then, okay, the other part, we wanted to see the category of pharmacy where you are based. Okay, we don't have anybody from academia or consultancy. And then we have 3 from community, institutional, both private and public. We have 4, and manufacturing. Okay, no, that's fine. So okay, so most of our colleagues have been around in this profession for more than 15 years. Here I can see the number is 7. We really appreciate that. So we'll be helping you also to navigate the system. We know for some, when we're talking technology is sometimes a challenge, but we're going to make it easy for you. And then, do you have any sub-role? So here we only having 3 tutors and 3 responsible pharmacists. Majority are not having sub-roles. Okay, that is good. And we only having 1 colleague who has submitted 6 CPDs. It means it's only one who's complying with the CPD requirements for 2022. Okay, let's see, Natalie. That's fine. We having there are 2 who have submitted 6 and then 1 more than 6. Thank you. So we will be helping all the colleagues who are not yet submitted the required number of CPD to find a better way of submitting, so that by the end of the year they are also meeting the CPD requirements. Right, now how to learn. Remember, CPD requirement is all about developing us or making us lifelong learners, so that we don't lose touch, just to make sure that we are always current and relevant. So how do we learn to make sure that we are current and relevant? Next slide, please. So continuing professional development is the process by which registered persons maintain and enhance their competency throughout professional career. and it encompasses a range of activities, including continuing education and supplementary training. And CPD enables registered person to develop in their area of practice and demonstrate competency. So let's go to the next slide so that we can see on the mode of learning that we can use to enhance our competencies. Here we will be looking at the CPD submission process. And I hope by now we all know that we are expected to submit 6 CPD entries per year, and there are 2 different cycles to pick from. So we're having what we call a 4-step cycle, and we're also having what we call a 2-step cycle. So with a 4-step cycle, there are no limitations on the CPD activities. So meaning you can submit as many CPD activities as you want using the 4-step cycle. And here what is required is planning. So you need to do some planning prior to submitting your CPDs, and you can only submit your entry once all the 4 steps of the cycle are completed. So unlike with the 2-step cycle, wherein this is limited to 3 CPD activities per year, meaning if you want to submit your CPDs using the 2-step cycle, you can only submit a maximum of 3, and this is instant, and there is no planning that is required as compared to the 4-step cycle. So let's go to the next slide. So these are the 4-step cycle. The first step there is reflection, and then followed by planning, implementation, and evaluation. So that's why we're saying with the 4-step cycle, there is a planning that one needs to make before a CPD entry can be submitted. So under reflection, you will be identifying an area that you need to improve on, and then from there you're going to plan what is it that I'm going to do in order to achieve a particular level of competency that you want. So if you're saying I will be maybe I will go to maybe you're saying you don't understand how to submit a CPD entry, and under your planning, you're saying you want to be able to submit, and how are you going to achieve that? Maybe you're saying I will go and watch the YouTube videos under SAPC page. So that will be part of your planning. And then from the implementation, you will tell us exactly what you have done to implement your plan. If you manage to go to the YouTube page, you watch the video, maybe you even practice, now you know how to submit a CPD, that's what you will say under the implementation. Then the last step, that is evaluation. Here you will be evaluating yourself. Did you meet or did you manage to achieve what you wanted? Did you manage to close the gap that was there, the gap maybe in terms of knowledge or skills? Are you now able to submit a CPD activity? Then if it is yes, then it means you're done. If it is no, it means there should be further interventions that you will make in order to achieve your initial goal. So that is what a 4-step CPD cycle is all about. I was just trying to give an easy example so that we can all follow. Next slide, please. And then with the 2-step CPD cycle, you can see there is no reflection, there is no planning. It means you just implement and evaluate. If you're saying, I don't understand how to do to complete an annual declaration, okay, then what are you doing? You go watch the YouTube video. And then from there, you're saying, I'm happy. Now I can complete my annual declaration. It's like you don't really have to plan like the 4-step cycle. So that is the difference between the two. Thank you. Okay, now we're going to look what constitutes a good CPD activity. So a good CPD activity should have a learning title, should have a learning need, a learning method or activity, and a learning outcome. So when we're talking of a learning title, it means that it should ensure that the title is appropriate and relevant to the domain. So this is taking us to the domains that we were discussing. Remember, we use public health as an example. So if you're having a CPD title that is under domain 1, it should be relevant to that domain. And then learning need, what knowledge gap do you seek to fill? So that should be clear as well on what is it that you want to achieve at the end of the learning. And then from there is a learning method or activity. And this will be is the method which you will be following to learn. It can be measurable, non-measurable, or structured. So we will explain the 3 terms when we move to the next slide. And then the last thing is that the learning outcome should indicate what you have learned and how did it improve your skill. So at the end of the day, you must be able to check what is the outcome. Did you achieve your target or not yet? So the learning outcome will assist you to evaluate that. Next slide, please. So here we are explaining the 3 mode of learning that we touched on. That is the non-measurable, which is indicated by number 1. Here we're referring to self-study, case study, attending conferences, etc. Those are the non-measurable mode of learning. And then we're also having what we call the measurable mode of learning. And here we're talking of the short courses that one can attend, reviewing an article, or maybe being invited as a guest or things like that. Those are the measurable learning measurable, yes, mode of learning. And then the other one is the 3rd one is what we refer to as the structured mode of learning. Here is the formal way of learning. One can be enrolled for a diploma or a postgraduate studies. So this is the formal mode of learning. So all these 3 modes are acceptable when you submitting your CPD activities. As long as there's something that you have learned, you are more than welcome to submit an activity on that. Next slide, please. Okay, and then we also having what we call a portfolio of evidence. Remember, pharmacists are not expected to submit a portfolio of evidence, but they need to have it ready in case it is required. They'll be able to submit it. So when we're talking of a portfolio of evidence, whatever you're putting in there as your evidence, remember, it must be current, it must be valid, it must be relevant, and as long as it's meeting all those 3 criteria, then according to us, the portfolio, your evidence is acceptable. So as much as I'm saying it must be there, but remember, you are not expected to upload any of your evidence. At this stage, only pharmacist interns are uploading their evidence since they are submitting for assessment, unlike us who are submitting for compliance. Okay, thank you. Next slide. Okay, here we're saying the CPD entry must relate to the learning during the current year. So when you're submitting your CPD entry, you can't submit an entry for something that you have learned in the previous year. That's why we were saying the evidence must be current. It means it should be within that year. And the evidence can be any document acquired in the learning process. And please don't upload anything, but keep your evidence in an electronic format with yourself. So for 2020, the evidence is no longer current. We won't take it. Even 2021, we have passed it. So the current evidence for this year is for 2022. Thank you. Next slide, please. Okay, here it's a page of how the CPD online looks like. So when you get into your secure site, this will be your landing page when you go to CPD. And then when you click on, on the left-hand side there is a menu. So those are the things that you can do while you are in this page. So here the annual declaration is the page that is active. So when you open annual declaration, this is what you will see. Here, this person did an annual declaration in 2020. If you can see there is a year. In 2020, this person did an annual declaration. In 2021, this person also submitted an annual declaration. And then it also shows the dates on which it was created. So you can see in 2021, it was created on the 7th of January. So this person complied with the requirement in 2022. For 2020, he submitted a little bit late. And this person is a pharmacist, the role there, and is also practicing, and meaning he's performing some of the activities pertaining to the scope of a pharmacist. And then the person has also completed the annual declaration. So there, you please note that you cannot update an annual declaration for the previous year. But if maybe in January you submitted an annual declaration while you were working maybe in a community pharmacy, and during the course of the year you decide to join the academic sector, you are allowed, the system will allow you to update your declaration, because remember, now that you have changed your sector, you might find that some of the activities that you were doing while you are in a hospital are no longer applicable when you are in an academic sector. So that's why you can only update for the current year. And then entries there is showing the number of CPDs submitted. So this person managed to submit 26 in 2020 and then 10 in 2021. So this shows how easy it is to submit CPD entries, because if someone can submit so many, then it should be easy. So this is what you will see on that page. And then what we want to draw your attention on is on, if you look at that down arrow there is a tab which is saying view entries. This is something new. It wasn't there before. We have added it this year. And this will allow you to see the CPDs that you have submitted for a particular year. Let's say in 2020, maybe you want to see what did you submit in 2021, so that this year you focus on something different. You can always refer to what was there. When you click on that tab, you'll be able to see all the CPDs that you submitted during that period. Next slide, please. So here it is showing, it means after clicking on that tab on CPD, it says what entries for 2020. These are the CPDs that were submitted in 2020. So you can have access to view them like that as you're planning for maybe your new CPDs for the new year. Okay, and then here it will also show you those that were submitted as via two-step cycle, and also the status there, it is archived. So don't be bothered by this archived status. All CPDs for the previous years, we are archiving them so that they don't disturb you as you continue with the new CPDs for the new year. So they are archived, and the date of submission there is also indicated. Thank you. Next slide, please. Okay, so here is the selection of compliance year. This is something new that we have also added this year. Previously, when you were submitting CPDs, it was just being submitted without being assigned a year of submission. So we have added that functionality there. So when you submit, the system, after you have completed all the 4 steps, when you press the submit button, it will ask you to indicate the year for which this CPD should be assigned to. So if you have, maybe it is, maybe let me say is the 1st of January, you didn't submit one CPD for 2022, and today is the 1st of January 2023. So you will be able to select 2022 so that it can assign that entry to the 2022, and then from there you would have submitted the 6 CPD for that year, and then you will be able to start the new year with the new CPDs for 2023. So this functionality is also assisting those interns who were designated, the pharmacists who were designated as non-practicing, because when they come to change their designation, they are expected to submit the CPDs for the year they were designated as non-practicing. So they will be able, if they were designated non-practicing for 2021, they will be able to select 2021 as they are submitting their CPDs, so that they can be, their designation can be changed. Thank you. Next slide, please. Okay, CPD submission deadlines. The 2021 CPD compliance year. What happened is, in 2020, there was a grace period that ended on the 31st May 2022. And then after that grace period, pharmacists were designated non-practicing if they didn't manage to submit the required 6 CPD activities. And then the responsible pharmacists and tutors were referred for disciplinary actions because council was requested or was mandated not to designate RP and tutors as non-practicing, since that will affect, like in case of tutors, the training of interns and pharmacist assistants will be affected. In terms of the RP, it means the pharmacists will be without RPs. So to avoid all those inconveniences, the RP and the tutors are referred for disciplinary actions. And then the 2022 CPD compliance year. So here we're recommending that the pharmacist submit one CPD entry every 2 months, and this will relieve the pressure of having to submit all the 6 CPDs during the last month, which can even end up not happening. So to avoid all those inconveniences, we're recommending that you do one every 2 months. And again, you are reminded of the submission deadline, which is the 31st December 2022. So that is the deadline for pharmacists. And then the highlights here, no assessment for competency. Like I said, only interns are submitting for assessment, but pharmacists are only submitting for competency. And then the no CPD points. Here there are no CPD points that will be assigned, and again, no third-party entries. So each pharmacist should submit his or her own CPD. Nobody should do it on their behalf. And then no non-practicing pharmacist in the pharmacy. So when we're saying you are non-practicing, it means you're no longer allowed to perform any of the scope of practice pertaining to pharmacists. Therefore, anybody who's non-practicing shouldn't be given access to the pharmacy. And we're encouraging pharmacists to be lifelong learners. Thank you. Next slide, please. Okay, here we're going to talk about the registration app that we are having here at Pharmacy Council. So the Council developed a registration mobile application to allow for digital registration card, uploading of pictures, amendment of personal details, and CPD system or CPD submission. So these are the functionalities that you will find when you go to the SAPC application. So remember, we're no longer issuing those cards that the way we used to. So now we're only working on the digital registration cards, and you can only have it from the application. So these are the functionalities of the app. In case you want to update your picture, you can do that from the app. And maybe you want also to update your personal details. Those things can be done without you having to contact the Office of Council. Thank you. Oh, okay. I think now it's time for questions, and I will hand over to Natalie to lead us. Thank you.
Thanks, Sabang. There are no questions at this point. Just a reminder to all attendees, if you're joining us on Microsoft Teams, you can ask your questions in the Q&A section. If you're joining us on YouTube, you can ask your questions in the comment section and we will answer them.
Anything, Natalie?
Not at this point, Sabang. I think let's give the attendees 1 more minute.
Okay.
All right. Well, the attendees are maybe thinking of questions to type. Just wanted to give a summary or of the CPD activities. I think most people think that CPD, recording of CPD activities is complicated and it takes time and so forth, but it doesn't, because it's a self-driven process where you identify your own learning need and you tell us how you addressed that particular need based on the four-step cycle. So it is as simple as reading a journal. It is as simple as conducting training in the workplace where you are training your fellow employees or colleagues. That is a CPD activity. So it is not complicated where you have to attend the CPD evening seminars, because we do understand that people do not have time to attend these seminars, but it is as simple as that. Reading a journal, updating an SOP in the workplace, that is a CPD. So you just have to explain to us in the four-step cycle how you're going to meet the need, and whether what is the impact of what you have learned on your daily practice. So yeah, it is not complicated, and we just urge all pharmacists to submit all the 6 CPD entries by the 31st of December this year. We do know that there's a grace period from January to April, but we do not encourage pharmacists to submit their CPD during the grace period, because it means that you will submit more. You will need to submit more CPD entries than the 6 in the next year. So we want to give you a space or a breather that if you submit by the 31st of December, you give yourself a breather, if I may put it that way, to say in the next year, you will only be required to submit 6, and we recommend that you submit 1 CPD entry every 2 months. You should have received CPD submission reminders. Please take note of those reminders and submit the CPD activities on time. Thank you. I'll hand over back to Thabang and Natalie. Thanks.
Thanks, Makwadi. There's a comment from Ashalia. I cannot enter my CPD using my phone.
Okay. As far as I know, the application is compatible with all the phones, unless if I'm missing something. So in that case, we will ask maybe Natalie for that person maybe to submit that query to the office, so that we can engage IT just to get the problem resolved.
Thanks, Thabang. We'll do so. Anonymous asks, are you going to do a live demonstration on how to submit a CPD?
Okay, Mr. Morano, maybe advise, can we do one?
Yes, we can do one. We can do one.
Okay, thank you. Yes, we will do one.
Okay. Does the South African Military Health Service fall under the public sector domain? I work in a warehousing environment, logistics.
I didn't get that one, Natalie. Maybe please repeat it.
Does the South African Military Health Service fall under the public sector domain?
Okay, thank you. Public sector. Okay, or is the person referring to public health domain, maybe, because we don't have public sector domain. The first domain is public health. So someone who's working in the military, yes, he should be doing one of the competent, if I don't understand the question. Thank you.
So
how do we know?
If I may just add to that one. So the domains and the competency standards relate to the scope of practice of a pharmacist. So it could be that some of the competency standards that are under that domain that you referred to, form part of your scope of practice, and you just need to check the competency standards and the behavioral statement to guide you on whether it aligns to what you do in your workplace on a daily basis. So it will not just be public health domain. There are other domains that you can check whether they fall within, in terms of the competency standards, whether they fall within the scope of practice, your scope of practice, and then you are able to submit CPD activities. So the domains are not necessarily based on private or public sector or so forth. They're based on the scope of practice of a pharmacist. Thank you, Natalie.
Thanks, Makodi. How do we know if the CPD item can be self-assessed or must be submitted for assessment?
Okay, maybe let me try to respond to that. CPD for pharmacists are not submitted for assessment, but a pharmacist can have a peer who can review his or her CPD. So, for example, I can request Mr. Moranu to do peer review for my CPDs, but that can only happen if he accepts my request. In case he doesn't, then unfortunately there's no way he can do the peer review. Yeah, thank you, Natalie.
May you kindly again just explain the difference between 2-step versus 4-step cycle?
Okay, can we please go back to the slides? But what it means when you're doing 4-step cycles, there are 4 CPD steps that you need to complete. The first step is reflection. So here you need to reflect on what is it that you want to learn. What gap are you intending to close in terms of the way you're practicing at the moment? And then once you have identified that gap, then now you're going to plan on what is it that you are going to do in order to close the gap. When are you going to do it? How are you going to do it? So here, that's where you will be saying, I'm gonna need 2 days for me to attend this. I mean, to have time to listen. Let's say somebody's saying, I'm working with data analysis and it's taking me long because I'm analyzing it manual. Maybe that is your reflection to say, I want to learn other means of analyzing data using Excel. And then now you're going to plan. How are you going to learn that? You can say, I'm going to watch the YouTube tutorials on how to use maybe VLOOKUP or pivot tables, so that you will be able to achieve or to close the gap that you have identified. So under planning, you just tell us, what is it that you're going to do? How are you going to do it? When are you going to do it? That is part of the planning. So if you're saying you're going to watch a video, and then after watching the video, you when you think you have gathered all the information you require, you can tell us how are you going to practice it until you gain that confidence that you can now confidently use that particular program to assist you with your work. So once you have planned, now you're going to implement. You're gonna tell us, did you manage to implement your plan? Did you manage to watch the YouTube videos? How long did you watch them? When did you watch them? And then what is it that you have learned there? And then all those things that you have planned, now you put in them, you tell us, how did you put them into action under implementation? Then the last step is evaluation. Here you're telling us, did you manage to achieve what you intended for at the beginning? Are you now able to use pivot tables? Are you now able to analyze data does this mean moving forward, you're no longer going to do it manual, but you will be doing it in a more efficient and effective way? So that is what you will tell us there under evaluation. And then when we go to the two-step cycle, there's no reflection, there's no planning. You just tell us, what have you done? Maybe while you were executing your duties, you realize that you don't understand maybe how to analyze a prescription. Maybe that is a gap that you're seeing as you're doing your work. Now you're gonna tell us, what have you done to close that gap? So there's no planning. You just tell us, okay, I went to and read under good pharmacy practice under this section where I've learned about how to analyze a prescription. Now I know I'm even doing it better. My colleagues or my pharmacy supervisor is no longer retaining the prescriptions that I've prepared. So here you just tell us, what have you done to close the gap? And then did you achieve it? And that's it. So there's no planning. Those are the two differences. Thank
All right,
you.
Thabang, if I may just add to that. So in terms of the four-step cycle, so the four-step cycle is actually what you do when you are actively learning. So you can see it involves planning, it involves identification of a learning need, then planning, implementation, and evaluation. So it's active learning. So what you have planned to learn, for example, for the year, right? So it's self-driven by a pharmacist or any registered person. But in terms of the two-step cycle, that is learning by accident. For instance, you might accompany your friend to a CPD evening. Maybe they're talking about diabetes, and you think you know about diabetes. When you get there, you learn something new. So it was not planned. So you just accompanied your colleague to that CPD evening, but you learned something. So that's how you apply then the two-step cycle to say, it's implementation, because you didn't plan for that activity or that evening, or you didn't plan for what you're going to learn, right? So you implemented by attending that CPD evening with a colleague, and then you evaluate the impact of what you've learned on your practice. So those are the two differences between the two-step cycle and the four-step cycle. Thank you.
We've got a question from YouTube. Good day. Is Council looking into a different way of achieving CPD compliance, seeing that the current mode is subjective?
Thabang, if I may answer that one, you need to explain what do you mean by saying that the current mode is subjective, because the current mode is based on compliance. You submit 6 CPD activities by following the steps of the CPD cycle, then you are deemed as CPD compliant. So I'm not sure when you say it's subjective what you mean. You need to elaborate some more.
Thanks. If my scope of work currently involves IT systems projects, is it relevant for me to submit either project management CPD activities or change management activities?
It's up to you. Remember, we do not prescribe what you need to submit. You are guided by the domains and the competence standards, and also the behavioral statements. So it's up to you what you want to submit to us. We do not prescribe it. So you have to go and read the competency standards for pharmacists and decide which CPD activity you should submit under which competency standard and domain. That is up to the pharmacist. Thank you.
With reference to non-practicing pharmacists, do you still pay an annual fee? What are the requirements from going from a non-practicing to a practicing pharmacist?
Okay.
Yes. Oh, Thabang, you want to take it?
No, you can continue, Mkwani.
All right. So you still are required to pay an annual fee. You are a pharmacist. It's just that you are non-practicing. So you are not performing the scope of practice of a pharmacist. So, but to remain in the register of pharmacists, you still have to pay the annual fee. And what was the second part of the question, Natalie?
Changing designation from non-practicing to practicing.
All right. So if you designated yourself at the beginning of the year as a non-practicing pharmacist by indicating that you do not perform any of the activities that relate to the scope of practice of a pharmacist at the beginning of the year, so we call that a voluntary designation as non-practicing or self-designation practicing. To get back or to change your designation back practicing, you are required to apply. There's an application form that you submit, and you pay about I think it's about 300 and something to change your designation to practicing again. And we do not have any other requirements in terms of the submission of CPD activities together with your application. But if the council designated you as non-practicing because you failed to comply with CPD requirements at the end of the year or at the end of the grace period, you are still required to submit the outstanding CPD activities for the year that you were deemed non-practicing, and you have to then apply for to change your designation to practicing, and the fee for that application is equivalent to the fee that is paid by the pharmacist annually. So it's equivalent to the pharmacist annual fee. I think it's about 2,100 and something, if I'm not mistaken. So the fees are different when you if you come from a non-practicing designation where you voluntarily designated yourself, or a non-practicing designation and a non-practicing designation where we designated you as non-practicing due to your failure to comply with CPD requirements. So yeah, so those are the requirements to get to change your designation back to practicing. Thank you. Tabang, you can take the next one.
Okay, thank you.
I have conducted training on adherence guidelines. May I submit that?
Yes. Okay. When we're looking at the 6 domains, he must look the one that is relating to training, and that's where you will submit that CPD. It's relevant, so it can be submitted.
What is the name of the app? I can't find it on iOS. This is from La Africa, Babalwa and Gwenze. The app on iOS, it's SAPC registration. When I try to update my declaration, even after I've saved it, it still keeps showing update declaration. What is missing? Why does it not save the changes?
It's still saying update the declaration. Because when we were looking at that pages, the update declaration will be there for the current year. I mean, that's where I was saying you are allowed to update, unless if I'm not getting the question right. It's only for the previous years where in that tab won't appear.
Yes.
Yes.
The update declaration, as Tabang has said, it will be there for the entire year, because you might have changed sectors. You find that you were working in a community pharmacy and now you're working in a manufacturing pharmacy. So the system allows you to go back to the annual declaration and update, for example, the sector. The scope of practice in the manufacturing might be different. It will be different from the scope of practice in a community. So you are still able to select the activities that relates to the scope of practice of a pharmacist in the sector that you are working at. And in terms of the name of the app, you are correct. The name of the app is the SAPC registration app. So you'll find it on iOS and also on Android. Thank you.
I work in the cosmetic industry in quality. Must I submit CPDs?
Is the person performing any of the acts pertaining to pharmacy? Because that's the question that we're going to ask. When doing the declaration, Did he answer that? I never do this to all the questions, because if he or she has declared himself as a non-practicing pharmacist, then there's no need. But if there is something that he is doing, then she will be expected to submit CPD activities.
I am unsure of how much detail to include under the 4 steps in the cycle. 2 paragraphs, 3 paragraphs, 4 sentences. I'm unsure as to how much to elaborate.
Currently, we are not really prescribing how much you must give, but the number, we only having the maximum number of characters that can be submitted per step. I think it's 1,000 characters, if I'm not mistaken, the maximum. But if you haven't reached the maximum, you can say as much as you want. Thank you.
A question from YouTube. Studying the CPD module online with a test is deemed measurable despite it being self-study.
Repeat it, Natalie, please.
Studying a CPD module online with a test is deemed measurable despite it being self-study.
Okay, measurable, is the person maybe enrolled for a short course or what? Is it a short course?
I think so. It says a CPD module online that has a test with it. So yes,
Okay,
I would say it's
yes,
measurable.
then
It's a short
is
course.
yes, if it's a short course, then it is measurable.
Okay, that's all the questions for now. I think if we can ask Makwadi to take over and give us a live demonstration of how to submit a CPD online, that would be great.
Okay. Makwadi, are you doing it? Makwadi?
All right. Yes. Can you hear me? Can you see my screen?
Yeah.
All right. Okay. So I've already logged on. I'm sure you all know how to log on onto the CPD system, right? On the blue strip on the left, right? That's where you can see the your dashboard, your annual declaration, reflection planning, evaluation, my submission, and so forth. So to capture or to capture the first CPD or a CPD activity, you're going to click on reflection here. And then you have a tab here that says identify a new learning need. Right? You click on the tab, and then it will bring you to the reflection page where you're going then to select your domain that you want to talk about. For example, let me select, for example, organization and management skills, right? And then you click on the domain competency. So you will see once you click on a domain, there'll be a list of competencies that are associated with that particular domain, right? So you'll have, for example, financial management, human resource management, and so forth, right? So let me select human resource management, and then here you select the learning trigger. So the learning trigger is what triggered you to want to learn about this particular thing that you've indicated under reflection title, right? So it could be appraisals, it could be an audit, it could be you felt that you did not have sufficient competencies. Maybe there's something that happened in your workplace that forced you to learn. For instance, maybe there was COVID. For example, is the COVID pandemic where we had to learn how to wear masks and so forth. So that's critical incidents. It could be triggered by feedback from colleagues, feedback from service users. It could be personal interest, something that you like. It could be reading journals, or maybe you're talking to a colleague and you realize that you need more information on this particular item or particular discussion, and then you went and did some research. So in this instance, let me select competencies. And then you say learning is related to which role. So your current role is currently, where are you working? Are you working in a maybe community pharmacy or institutional, or is it a new role? Maybe you've just been appointed to a particular position. Your learning you'll select there is related to the new role, or it could be both current and new role, right? So let's select current role here. And then in terms of learning initiation, you're going to select whether the learning was from top down. It could be that your boss requested you to do something. So it was initiated by your boss. It could be bottom down. The people that report to you, it could be your stakeholders, your customers requested for certain information or for something. And then it was initiated by them. Or it could be lateral, it could be your colleagues or even yourself. You can initiate. Let's, in this instance, select top down. And then here you're going to say, for example, I'm not going to type here. I'm just going to say you are in a management position, and you are required to recruit or to recruit and appoint a manager or a subordinate in the unit, and you wanted to know how to develop interview questions that will ensure that you appoint the most suitable candidate. So that's what you will write, for instance, that you wanted to know how to develop interview questions to ensure that you appoint the most appropriate or suitable candidate. So what you hope to achieve is that at the end of the process, you want to appoint the most suitable candidate. So that's just for an example. So I'm just going to put anything there. So that's just an example, right? Then you click on save here.
Maybe Mokwadi, the
Yeah.
reflection title, yes.
Yeah, sorry, I didn't type the reflection. Okay, obviously the title must be very descriptive on what you want to do. So this I'm just cutting it short here so that we can move on to the next step. All right. So okay, let me go back there. Sorry. Okay, see here it doesn't. Okay, I'm going to go back to that planning. Okay. Okay, so all right, we've already described what we want to achieve under the reflection page.
Mokwadi, maybe on the reflection page, I'm sorry, may you please go back? Yes, I wanted to make colleagues aware. There was somebody asking how much information they must give when they're responding. So on that last, I think it's the last the last space provided, wherein you were giving detailed information regarding the reflection. Yes, here. So can you see the number of characters? They were 1,000 initially. As you type, the number reduces. So this is what will guide you whether you have exceeded the limit or you are still within the limit. Thank you.
Thank you, Tabang. All right, so it will ask you there, proceed to planning. Reflection title is saved. Would you like to continue to planning? If you want to stop it there to come back at a later stage, you just click on no. And if you want to continue, you just click on yes. Then it will take you to the planning stage, all right, or the planning step. And then under planning step, we've got the following headings. It says mode of learning. So you're going to select, in this instance, is non-measurable because I'm going to interact with colleagues, with other senior managers that have been around for a long time to advise me on how to set interview questions to ensure that the right candidate is appointed or suitable candidate is appointed. Right, so here we can select primary activities, just a meeting with the colleagues, breakfast meeting, and so forth. So here you're going to select the start date. Let me select maybe, let's say, the 15th of November, and then the end date for that particular activity is that the 30th of September. So under this, briefly describe the reasoning behind your planning selection. For me, I selected that I'm going to be talking to my colleagues who are senior managers, who've been senior managers for a while. So I'm going to say that I selected to engage or to talk with my colleagues because of their experience in conducting interviews and so forth, and their experience in setting or coming up with interview questions. I felt this was the best approach because I feel that it will be more effective and it will be quicker rather than going to reading the books, because this was an urgent interview that needed to be done and so forth. So you just have to provide a reason why you selected that particular planning. Oh, yeah. So you can give a reason to say, talk to colleagues. It was a discussion that we had, and I drafted questions, and then I showed it to them to provide input and so forth, because I felt that this was a quicker way of developing or designing questions for interviews, because of the limited time I had to recruit and appoint a new person in the department. Things like that. So you can add. You have 1,000 characters. You may add as much information as you prefer. All right, then you click on save. All right. So if you decide maybe you don't want to continue for the day, maybe you got interrupted or you have other responsibilities to take care of, you may just click on no there where it says, would you like to continue with implementation? All right, in this case, we'll click on yes, and then here you have to select the duration of the activity. All right, let's say it took me 60 to 90 minutes. All right, so you describe what you've done. You just described that I had a meeting on this particular date with my colleagues prior to the interviews. The meeting was scheduled for an hour before the interviews, and I engaged with the colleagues, drafted a few questions and provided them for input, and they provided input, and the questions were used to conduct interviews. And your assessment of the questions, you felt that the questions were clear and understandable, and that the colleagues or the candidates indicated at the end of the interview that the questions were clear and understandable, something like that, right? So then you type and tell us the story there of what you've done, and then you click on save there, and then same message, proceed to evaluation. Would you like to continue to evaluation? You're going to say no if you have other things to do and you don't want to continue at that moment, or you click on yes to continue, right? So under evaluation here, you're going to then select whether you've met the learning objective fully, partially, or not met. It could be that what you wanted to learn, you did not actually learn much. So you felt that you did not meet, your learning objectives that you set out as described under your reflection, right? It could be that you didn't meet, or you met it fully. So in this, we're going to select fully for now. And then you'll say, apply the learning in my workplace, because under the evaluation, you have to tell us of another scenario where you applied what you've learned, because we want to see that what you have learned has had an impact on your practice going forward. So implementation will tell us what you've done, but then evaluation will tell us how you have applied that what you have learned in a new setting now, or in a new scenario. So you're going to describe that to us. So you will say, if maybe let's say you learned something yesterday and you have not yet implemented it in another scenario in the workplace, you click on not yet, right? It could be that you've learned something but you've implemented it outside your workplace, right? Or you learned something and you've implemented it in your workplace. So you select whichever is applicable there. Right, and before you submit, you have to select the compliance year for which you are submitting the CPD entry for, right? It could be that maybe you are changing, you've applied to change your designation to practicing, and you fail to comply with 2021 CPD requirements. So you didn't submit 6 for 2021, and as part of your application requirements, you need to submit the outstanding number of CPD activities for the year in which you are deemed non-practicing due to your failure to comply with CPD requirements. So here you can select 2021, you can select 2020 or 2022. So for those that are changing their designation following a change of their designation to non-practicing for failure to comply with previous year's CPD requirement, you would select, for example, 2021, so that you ensure that you have 6 CPD activities in order for your application to be processed. But if you are submitting CPD activities for the current year, you actually do not need to select anything because the default year is 2022, right? So the default year is 2022. So if you do not select a year, it will allocate your CPD activity for the 2022 CPD compliance year. Right? So yeah, then you select the year there, and then here it says describe what you have learned and providing examples. As I said, evaluation takes a step further to say, we know what you've implemented, provide examples, other examples of how you have used the information in the workplace, or it could be outside the workplace, right? And how you have applied what you have learned, and including feedback on the impact of your learning. So you're going to tell us that it has, what I've learned has improved my practice in this way and that way and that way, So maybe it has improved my service delivery in that I do not need to refer to your references every time a patient comes in and so forth. So those are just some examples that you can use there. All right. So you also have 1,000 characters there. So you describe providing examples what you've learned, and also the feedback or the impact of your learning on your practice, your daily practice as a pharmacist, right? And then after you've done that, if you feel that you want to go back to a CPD activity or entry at the latest stage, you're not ready to submit, you may just click on save here to save that entry so that you are able to access it at a later date or time. All right, so you click on save. But if you feel that you are ready to submit the CPD for compliance, you may click on submit, right, for compliance, or you may click on self-review. But self-review you have not yet submitted because it's coming to yourself, so you still have to go back and review that CPD activity yourself. Or you may submit it to your peer. You click on submit to your peer. Your peer will get a notification to say that you have submitted a CPD activity for them to review the activity. So with peer review, once you click on peer review, that CPD is automatically submitted for compliance. So you don't have to worry to say that my colleague is not reviewing my CPD and think that the CPD activity is not submitted to council, right, for compliance. So that is that. We advise pharmacists to talk to their colleagues before they click on submit for peer review, so that you make an arrangement with your colleague to review your entry. But even if they don't review your entry would be submitted to us at the same time. So you don't have to worry about that. So that is how you submit your CPD activity. As I said, the CPD entries are simple, so we don't need to complicate them. For instance, if you are doing your master's, your research, or postgraduate qualification, you can write a CPD on your research thesis or your or your plan to conduct your research. So it's not as complicated as people make it out to be. You can talk about your how you came up with your research topic and so forth. Talk about how you implemented, how you drafted the document that you're going to submit for approval before you conduct your research and so forth. So it is as simple as complicated. You read the article or you conduct training in the workplace, you can capture that as a CPD activity. Actually, this whole presentation can be captured as a CPD activity, to say I attended a CPD empowerment or masterclass, empowerment workshop or masterclass, and this is what I learned. So you can capture that as a CPD. So it doesn't have to be complicated. So once you get the hang of the system, you can actually capture one CPD entry in 15 minutes or less. So it's not as complicated as people make it out to be. Currently, we're not yet at that place. We are assessing CPD activities that are submitted by pharmacists. So I hope that explains the process, how to submit your CPD activity. And if you would like to submit the two-step CPD activity, you'll see there on the left, on the blue tab again, you can click on two-step activity there on the left, and then you can submit up to 3 CPD activity as two-step CPD using the two-step CPD cycle. So that is how we. I think the system is slow now, but that's how you capture the CPD activity. So it's the same. If you decide to capture it on the CPD SAPC registration app, is the same process to follow, right? So that is the end of it. Natalie, I don't know if there are any more questions.
Thanks, Makwadi. There is a follow-up from an earlier question from YouTube. By subjective, I mean that it's only for compliance purposes. There's no measure or actual evidence of professional development.
That is correct for now, because it's a new system that we are implementing. We didn't want to introduce assessments of CPD activities currently. But if you look on the blue ribbon on the left, you do have assessments there, right? So in the future, we're going to be assessing CPD for competence in the future, but not yet, because we're still trying to get pharmacists into a culture of continuing professional development. And once we feel that pharmacists have adopted this culture, we will then implement the assessments, where we will then call upon evidence to be submitted by pharmacists. This evidence will be a sample, or the request for evidence will be from a sample per year of pharmacists, where we will then assess competence and compliance. Competence. So we're not yet there, but we will get there slowly but surely. Thanks.
Thanks, Makwadi. There's one last question. For the SAPC registration app, when you enter your PIN number, a password is required. When the same password is entered that you use to log onto the website, it gives an error message, log failed, invalid username or password. But the exact same details work on the website. I just checked again now.
All right. In that instance, we advise you to send us an email so that we can escalate that to the developer to investigate what the issue is with the app, and then we'll provide you with feedback. But it shouldn't do that. It should allow you to access it once you capture your login details correctly. Yeah, we will assist you if you can just forward us an email. Thank you.
Thanks, Makwadi. That was the last question.
All right. Thank you. I just wanted to give Tabang an opportunity if she still wants to say something. Tabang?
Yes. Mukwadi, I think we are done. We touched everything on our presentation. And what I can say to colleagues is just to encourage them to just start. Once you do the first CPD, you will see how easy it is. And we wish you all the best, just to make sure that you comply with the requirements. That is our wish, because we don't want you to be going through all the process of changing designation and all others which may affect you financially. So the sooner you start, the better. Thank you so much.
Thank you, Tabang. I think we have reached the end of the session. We would like to wish you all the best for your journey with regard to CPDs, and also we wish you well for the festive season. Stay safe until we meet again. Have a lovely evening. Thank you for your time. We really appreciate it. Thank you, and that's the end of the session. Goodbye.